Okay, the first laboratory activity for the Hema one, we have here your method for the blood smear. We have here the method for your blood collection. Sorry. Okay, we have here the method for the blood collection procedure. Okay, so when we're collecting the blood, the first thing that we're going to consider here, number one, is how much of the blood are we going to need here for our particular procedure laboratory activity or laboratory test. And second one, what are your instruments or what equipments do you have? So like, for example, if you are needing blood, like for the blood chemistry and several other um, blood examination procedure, like if the patient would have their several blood requests, so one for the hema, one for the chemistry, one for the serology, then you'll be needing much of the blood. And therefore, the best method for the collection would be your whole blood extraction by your venipuncture or even by your ETS. Okay, but when we are needing only small volume of the blood, then we'll be just performing here the skin puncture or capillary puncture. Okay, so when we are needing here smaller volume the blood here, like in the test procedure, what includes your blood typing or even your manual procedure for your CBC, like if the patient vein is very fragile or the patients would have very difficult na vein, wherein you just be needing not that much of the blood volume, then you could also perform the CBC by your skin puncture. Or you could also perform here your skin puncture for your blood smear preparation. So for today, we'll be doing here the capillary puncture or your skin puncture. Okay, the blood collected through your skin puncture or capillary puncture, we call this puncture capillary blood. It's a capillary blood because it's a combination of the different sources of the blood. So it's combination of the arterial blood, your venous blood, and your interstitial fluid. And therefore, we call it was capillary blood. So, pag sinabing capillary blood, we're talking about the blood collected through your skin puncture. So, for this procedure, what we are needing, number one, you just need to have your lancet. Okay, so for the lancet, pwede siyang lancet lang, pwede siyang feather na lancet. Feather lancet is used for the newborn screening. And although it would have your deeper siya na puncture and would have you able you to bleed the patient much, able to collect much of the blood from that. But sometimes you could also use here your lancet, much thicker na lancet, yung maliit. I mean yung hindi feather na lancet. Okay, when you are doing this procedure, although may available tayo na pricker, but then when you are starting your work as a med tech starting or to be oriented with different procedure, you go with a manual. Hindi pwede gumamit ng pricker. So manual na pricking dapat ang ginagawa natin. Another one, what we are needing here for your skin puncture would be your capillary tubes, or you call it once your capillet. Our capillary tube could have your blue band. So may mga band dito, may line. Or we have also here the red band. Ang pinagkaiba ng blue band sa red band, the red band here would have the anticoagulant heparin and the blue band wala siyang heparin. Okay, so the red band meron siyang heparin na anticoagulant. So mean to say pag nag-collect tayo ng blood with your red band, if I try to mix that one, your blood will not able to be clotted. But unlike in the blue band, magkaklat ang blood natin. Saan ginagamit ang blue band sa red band natin? Okay, the blue band, ginagamit siya if you collect your blood, if the source of blood is your EDTA collected na blood. Okay, so since ang EDTA may anticoagulant, ang blue band natin walang anticoagulant na capillary tube, that would able to maintain the normal anticoagulant blood ratio. On the other hand, the red band, since may anticoagulant siya, may heparin, so ang source ng blood natin dapat ay walang anticoagulant. So, if you are collecting your blood directly from your skin puncture, so since ito ang blood natin dito, okay, if you try to puncture that one, wala siyang anticoagulant. And since this one may anticoagulant, so that would be able to maintain here the blood anticoagulant ratio. Hindi tayo pwedeng gumamit ng red band or heparinize tapos ang ating source ng blood is your EDTA. Because ang EDTA may anticoagulant, ang red band ay may anticoagulant, that would result here to over anticoagulation and it would have an effects with the morphology of our RBC. Okay, another one, gagamit tayo ng clay para isi-seal ang ating capillary tube. Okay, procedure for your skin puncture. So, number one, you need to prepare your materials. Then, you need to wear your PPE, gloves, and all. Another one is, next, we have here your select your puncture site. Okay, ideally, for the puncture site, if your patient is a newborn and infants, then sa plantar, sa paa. Okay, so there are two sides for that. If this one is sa paa, this is the central, and we have the lateral. Okay, dito tayo magpa-puncture sa edge. Okay, between your lateral and medial side, okay, sa gitna versus 1, mas ideal ito na side. Kasi dito may posterior tibial artery. May artery dito, baka ma-puncture natin. So dito tayo ng side. Do not puncture in this area, wala kang makukuhang dugo. Or you could puncture also the big toe. Okay, you can puncture that one as provided here the baby started to walk already. Pag hindi siya nag-walk pa, then maliit pa ito, then you puncture this area. Okay, for the adult patients, so third and fourth finger would be the ideal na punctured site for that. Okay, then, okay, you prepare your materials here. So after that one, you clean the punctured site. If you have your finger, okay, you have your 70% isopropyl alcohol. Still apply ang circular motion. Okay, then after that one, air dry. And position here your puncture site. So, bago tayo mag-puncture, you need to massage muna ito. Okay, that would allow the distribution of the blood in this area. And do not puncture pag cold ang hand ni patient. Pag malamig ito, wala kang makukuhang dugo. And make sure na you need to massage that would allow the distribution of the blood in this area papunta dito sa punctured area. Okay, then position your hand. Pag nag-prick tayo, so you try to retract here. So, iganon mo yung isang hand niya. Okay, then position ang ating lancet, okay, as close as possible with your finger of the patient. Hindi pwede na maganon ha. Okay, so ganun lang siya, medyo ilapit mo siya and then iganon mo lang siya. Ganun lang. Hindi pwede na iganon natin. Okay, so ganun lang, i-position na malapit, then iganon mo lang siya. Okay, another one, make sure na okay, approximately ang deep ng puncture natin ay ang depth ng puncture, ang depth ng puncture natin ay dapat not more than 2 mm deep. Okay, why not more than 2 mm deep here? Because the capillaries is between your and your skin. Okay, ang capillaries natin ay nasa less than 2 mm lang siya. Less than 2 mm deep. So, mean to say, ang depth of the puncture, so dapat not more than 2 mm. Kasi pag more than 2, pag malalim na, iba na matutusok natin. You'll be able to puncture the bone of the patient na. Okay, then after that one, pag na-puncture ka, okay, the first drop of the blood should be wiped off. Okay, you need to wipe off here the first drop of the blood because that one is contaminated, the blood sample, because this one is still contaminated with the skin tissues. Okay, then, okay, wipe off ng dry cotton, then massage, and wait that the blood here able to form a drop of the blood before you try to aspirate with your capillary tube. Okay, the proper positioning here of the capillary tube, since may band dito sa side, sa other end niya walang band. Dito tayo na side sa walang band, dito mo siya i-aspirate ang blood sample. Wala namang wala namang kung aling side ang ating, wala namang effect whether so kung aling side ka, kung doon ka ba sa side na may band or walang band. But the proper procedure, try to collect that one on the side na walang band. Kasi pag nag-seal tayo mamaya sa clay natin, itong clay natin, sa seal natin one end mamaya, Okay, so eventually ang band natin, kung dito ka mag-seal sa end, makikita mo pa din ang band. Okay, kasi pag dito ka nag-seal, dito ka nag-fill ng blood, tapos ito magiging sealing area mo, ito masiseal mo na area, so mawawala, hindi mo makita ang band. But in the effect, with the result, wala siyang effect actually. Okay, then, as you try to collect the blood, make sure na walang space. Meaning to say, bago tayo paano tayo magko-collect ng blood? I-position mo ang capillary tube here na much lower para magdali siya, mapumasok ang blood, you're able to aspirate that one with your capillary, with your, okay, by capillary action. Okay, then make sure nagpo-form siya ng drop, okay, bago ka mag-collect ng blood. Kasi pag hindi siya nag-form ng drop, ano mangyari? Madaming space dito in between. And pag na-practical exam tayo, or magpa-practical exam, usually pag nagkaroon ng space, minaminusan ko. Although, wala namang effect ang space sa blood natin. Okay, or field stripe, because it's a centrifuge pa din natin, magpapack, magsisettle pa din yan. But then, pag madaming space, it would identify na poor ang ating collection technique. Kaya as much possible, wala dapat siyang space. Then after that one, you'll be collecting here approximately 2 capillary tubes. And try to fill your capillary tube with a 3/4 volume. So dapat hindi siya punong-puno. Okay, so mga 3/4 volume. Why 3/4 lang? Kasi pag nag-seal tayo dito mamaya sa clay, pag punong-puno ito, aapaw siya. Pag umapaw siya, it would have your effects. Okay, like if you are having your hematocrit determination, it might eventually baka, since pag hematocrit ang ginagawa kasi natin, we take the ratio of your PRBC, packed red blood cell, over the total volume. So baka mga lumabas na mga component ay, it might, hindi siya magpo-provide ng true reflection ng ating hematocrit volume. That's why you're just required to approximately fill this one 3/4 volume para hindi siya umapaw pag nag-seal tayo. Then, pag napuno na siya, hawakan mo ang one end, ganon, isi-seal mo siya, tapos isi-seal mo dito sa clay natin. Tusok mo lang. Dapat mo ginaganon ditong one end niya kasi pag hinayaan mo lang, anong mangyayari? Ang blood mo ay magtatapon. Okay, mag-flow dito, mawala ang blood natin. That's why you need to seal the one end para ma-hold mo ang volume while you are sealing one end of your capillary tube with your clay. Okay, then after that one, so try to apply pressure on the punctured area and then put bandage on it. Okay, and okay, that's your capillary puncture. Okay, thank you.